everyone. My name is Ariella, and today I'll be presenting with Chelsea, Brendan, Amber. The title of our research proposal is Self-Reported Oral Health Outcomes After Mask Wearing Among Inland Empire Adults. Face masks have been one of the first recommendations the CDC has advocated in preventing COVID-19 transmission. Despite the strong benefits of wearing a mask, there has been potential health-related side effects that have been brought to attention. A recent study by Canzo reported that the use of face masks increased the perception of dry mouth and halitosis. Pinzon and colleagues showed that with the use of masks, toothbrushing frequency decreased and people were significantly less concerned about their oral hygiene, nor were they inclined to visit their dentist. The objective of this cross-sectional study was to evaluate whether extensive wearing of masks may have potential negative effects such as dry mouth, halitosis, and an overall decline in personal daily oral hygiene. We hypothesized that the longer the duration of mask wearing would be associated with a statistically significant decrease in personal oral hygiene and an increase in self-perceived halitosis and xerostomia. The results will be significant in guiding comprehensive preventative and therapeutic strategies in relation to oral healthcare in a multidisciplinary approach.
IRB approved our study as a cross-sectional study. The student investigators came up with 17 wide-ranging questions. There were 6 questions on demographics, 3 questions on oral healthcare habits, 2 questions on the duration and types of masks they used, and a total of 6 questions on self-perceived symptoms and their attitudes on dental visits. As a 5-point Likert scale was used in response to the questions, which range from strongly agree to strongly disagree. The student investigators went out to shopping centers and parks in 6 different cities that were all in the San Bernardino County. We approached adults 18 years and older and asked if they would consent and complete our survey. The cities involved were Loma Linda, Redlands, Colton, Ontario, Fontana, Victorville. To test our hypothesis, we used a chi-square test.
So we approached 207 people in San Bernardino County. 71%, or 147 people, participated in our study. The demographics of our study found an overrepresentation of females and the elderly as compared to the demographics of San Bernardino County at large. The ethnicity distribution aligned with the distribution of the Inland Empire. Educational levels range from less than high school to graduate degrees, with the majority of our respondents choosing some college education. When looking at oral healthcare habits, we found that a majority of our respondents brush their teeth twice a day and half floss daily. Finally, when looking at the perceived oral symptoms from mask wearing and inclination to dental visits, we reported that 53.7% noted dry mouth, 36% noted bad breath, 40% were less inclined to visit their dentist, and 18% changed their oral healthcare habits. There was no statistically significant correlation between duration of mask wearing and change in oral health habits. However, rates of perceived dry mouth in this cohort was 53.7%, which is significantly higher than what was reported in the literature, with a percentage of 22%. While our results were observed to be clinically significant and in the direction of our research hypothesis, there was no statistically significant difference in wear time of 3 hours or less and greater than 3 hours in the frequency of perceived dry mouth, bad breath, and change in oral healthcare habits, with our alpha level of 0.05.
The COVID-19 pandemic has prompted new public health measures, the development of innovative technology to prevent and overcome the disease, and has created many uncertainties. The dental hygienist plays an integral role in assisting individuals and groups in achieving and maintaining optimal oral health. Dental hygienists provide educational, clinical, and consultative services to individuals and populations of all ages in a variety of settings and capacities. As such, the identification of potential subjective or objective oral health side effects of new protective measures in regards to mask wearing is highly relevant and significant. Based on the results, we accepted our hypothesis. The rate of perceived dry mouth, was greater than reported in the literature, and a high percentage of participants experienced bad breath and were less inclined to see their dentist. Our study results from the Inland Empire were supported by the studies that were carried out in Germany and in Brazil. It is noteworthy to mention that the mask wearing time, whether short or prolonged, did not affect perceived symptoms of dry mouth, bad breath, and change in oral habits. Limitations of the study included sample size. A more comprehensive study with proper sample size calculation will enable regression analysis on factors such as gender, age, category, ethnicity, and education level. The study results are highly significant as they corroborate with other study results and provide solid data for further sample size calculation. It also provides information on how to educate and address patients' concern on potential oral health side effects of mask wearing and recommend solutions to overcome the symptoms. Future studies need to analyze whether the use of face masks lead to objectively measurable change in dry mouth or bad breath. Within the limitation of the study, we conclude that the use of face masks increased the perception of dry mouth and bad breath. It also affected the inclination to visit the dentist in a negative way. Dental hygiene should be aware of the potential oral side effects and educate and guide patients to maintain and improve their oral health. Thank you.